Welcome to HHP's Night at the Oscars. I am Anissa Zankovic, Dean of the College of Health and Human Performance. It's exciting to celebrate philanthropy, service, and accomplishments with you this evening. I enjoyed seeing so many pictures from the 2021 Cornerstone Society members. You are our stars for this event. At the end of the program, we will share with you the names of all Cornerstone Society members. Thank you for your continued generosity. I am happy to announce that HHP is the leader among all schools and colleges in the Academic Affairs Division for the highest number of new donors during last fiscal year. We had 103 new donors supporting HHP, an outstanding accomplishment. I am also glad to report that HHP gifts are up by $2 million in the last 2 years, for a total of $5 million in gifts in the last fiscal year. In addition to support from individuals, we have also received support from several foundations and corporations, including the Everett D. and Geneva V. Sugarbaker Foundation. They donated nearly $20,000 to outfit a mobile unit to house the PD sensory space, which will allow us to create a supportive environment for athletic fans and others who experience sensory overload. You will hear more about this project later and other support that it has gained. We have faced many challenges since March 2020, but during that same time, we have adapted to support our students, faculty, staff, and community. Those adaptations have become points of distinction. HHP faculty have collaborated on several COVID-related research projects, and we will grant you exclusive access to these. We are also on the heels of a successful second prevention science initiative titled Aging Well Together. We hosted a series of monthly speakers spanning research and engagement and a 3-day documentary film festival. Next year's initiative will be on trauma and resilience. The next part of our program will spotlight excellence in philanthropy. We are grateful to Ms. Lee Fanning, ECU Board of Trustees member, and her sister, Mrs. Ellen Jeffries Bland, for their generous donations to the PD Sensory Room. Dr. Jennifer Hodson, professor in the Department of Human Development and Family Science, will elaborate more on their gifts and this project. She is followed by Ms. Wanda Montano, who serves as chair of the HHP Advancement Council. We are grateful to these generous donors for their support.
Hi, I'm Jennifer Hodson from the College of Health and Human Performance in the Department of Human Development and Family Science. I would like to honor two very special donors, Lee Fanning and Ellen Bland, for their support of the PD Sensory Project. This is a project that is designed to help create safe, calm spaces on campus for people who are visiting to any of the ECU events. It was piloted last spring during men's basketball games in the Minges Motor Development Lab. We were able to help over 20 families to stay in attendance at the event while their loved one who was experiencing sensory overwhelm was able to calm. We're hoping to expand this program to also find safe spaces and calming spaces for our wounded warriors who also come to campus and who need that same sort of opportunity. And with the support of people like Lee Fanning and Ellen Bland, this is going to be such a powerful demonstration of East Carolina University's commitment to diversity, equity, inclusion. Lee Fanning is a Board of Trustee member for East Carolina University, and Ellen Bland is an advisor to a housing corporation for Alpha Delta Pi. Ellen Bland also is on a foundational board for Wayne Community College. So both of these amazing donors have such a heart and spirit for campus environments and how important they are. They have just given with such generosity and such support that we need to stop and thank them, because without them, the projects like this just wouldn't be possible.
Good evening, everyone. It's HHP's Night at the Oscars. I'm Wanda Montano, a graduate of the School of Social Work, and I serve as chair of the Advancement Council for HHP and also as vice chair of the ECU Board of Visitors. I am honored that Dean Z asked me to participate tonight and to spend just a few minutes talking about the impact of ECU on our students, our region, and our state. That impact fuels my passion to give to ECU. I give primarily for three reasons. First, ECU is and continues to be the home of many first-generation students. I was a first-gen student and strongly believe that serving these first-generation students is one of the core values we treasure and one that we do so very well. Continuing to support college opportunities for other first-generation students drives my giving. Second, when I reflect that only about 10% of women attended college in the 70s when I was at ECU, I realized just how fortunate I was to have had my college experience. That encourages me to support that opportunity for others. Third, when I chat with my friends about how we achieved our successes in life, one theme resonates across our shared life experiences, be it corporate, military, nonprofit, or academia. We all had great mentors influencing our lives, guiding us as we made decisions, cheering for us when we did really well, and commiserating when things were not so good. In addition to providing financial support for students, I look for opportunities to mentor and support our students in those unquantifiable ways that are sometimes the difference between success and failure. This demonstrated service, both financially and through mentoring, shows our students that we, the alumni, live the why of our motto of service. Teaching and demonstrating this why means that these students will experience our philanthropy and learn about giving back. Their what, why, and how of giving back to ECU will then follow. And so from the purple in my hair, to the purple blood that runs through me, to the purple polish on my toes, I live and breathe all things pirate. My fifth grade teacher wrote on my report card, if Wanda would only slow down. How many of you think Miss Warner got her wish? So this old 68-year-old still has that same sense of urgency I had as a fifth grader, to inspire and mentor someone to be the best person possible, to serve their community, and to live the values of Pirate Nation. Purple!
HHP faculty have been at the forefront of providing expertise and lending our efforts in the university's program promoting mask wearing, #PiratesMaskUp. We've also hosted the university's contact tracing initiatives with HEP faculty member Kelly Russell leading the all-university effort, including undergraduate interns learning about contact tracing and gaining valuable skills. There are many more ways that our faculty have been involved and continue to be involved in COVID-19 research and outreach. Now, join me for exclusive access to our laboratories, research, and other work.
Hi, I'm Nick Murray from the Department of Kinesiology at ECU, and we are working on a COVID project. And what we're doing is we're looking for individuals who have tested positive but are in a mild to moderate category and who are not being hospitalized. And the goal of this project is to track their disease state or disease outcomes for the first 14 days of once they've tested positive. And in doing so, we are tracking both their heart rate variability and a number of psychological variables in order to see their both well-being and to track their well-being, and also to track how their heart rate variability changes over time. Heart rate variability is an interesting measure of heart rate where we look at the beat-to-beat variation between successive heartbeats.
Hi, my name is Linda Bolin. I'm a faculty member over at the College of Nursing, and I feel very honored to be part of this study. And so not only are we collecting the data that we need to find out more about their physiology and some of the factors that will give us information down the road, but we're also providing a service to them. So we have couple of members of our team members are counselors, and so they're very well equipped for this, and we have different surveys that we use, and we are in contact with them constantly during the study for 2 weeks. So it helps them in understanding their own physiology and giving them something that they can do to make a difference for themselves. As we know, COVID affects everyone differently. Some people are very asymptomatic. Some people just have issues with taste and appetite. Other participants have much more of a respiratory component to it. So the breathing component teaching that we do really helps them a lot.
Hi, I'm Matthew Fish, Associate Professor in the Department of Recreation Sciences, also one of the co-directors for the Center for Applied Psychophysiology. And we'd just like to say thank you to all the donors out there that helped make this activity or research project possible. Without donors like yourselves, we would not have been able to secure the tablets, reach out to our local community, and provide the services that can hopefully help them overcome COVID or at least be better assisted moving forward. At the center, we work with our community as well as we work a lot with service members. And without, again, the help of donors like yourselves, we wouldn't be able to do all the things that we do. And we just want to say thank you.
My name is Lok Pokhrel. I'm an assistant professor of toxicology in the Department of Public Health and Department of Health Education and Promotion here at ECU. So we have been working on SNAT technology, S-N-A-T, SNAT. SNAT stands for Smart Nanotechnology Enabled Combination Therapy against SARS-CoV-2, COVID-19. Smart technology is a really unique technology. It is a nanobubble technology with metallic particle, nanoparticle, as well as very low dose of cancer drug combined with the metallic nanoparticle. And all of these are bound together within a nanobubble less than 100 nanometer size. By doing so, we hope that this combination therapy will be effective against COVID-19, SARS-CoV-2. Our SNAT is also very cost effective. For 4 doses given within 2 days of time period, we believe the cost will be less than 10 cents per patient per course. While you compare with remdesivir, the cost is around $5,000 per patient. Our SNAT is room temperature stable versus remdesivir, which requires cold storage at minus 80 degrees Celsius, which is not available in most rural part as well as in resource limited setting or countries. So in this regard, our SNAT being room temperature stable can be easily available and stored anywhere. The COVID came along, and then we thought perhaps we have something great formulation that we can test against this coronavirus. So as we studied our particles further, we figured that we can still include these formulations within the nanobubble. Now, why nanobubble? Nanobubble is really unique because it carries oxygen within the bubble. And one of the problems with COVID patient is that they lack oxygen. They have less than 94% of oxygen. So although our dose is smaller, that's our intent, perhaps our nanobubble could provide a burst of oxygen within the lung cells, and perhaps that will provide some relief from COVID-19 for the patients from COVID-19. So in that regard, as you can see, we have nanobubbles being created here. So we use electrosplitting process, which will allow us to generate nanobubbles. The solution already is our SNAT formulation, and as we bubble the solution, the bubbles are created and the particles will enter within the bubbles. We are in the process of testing how stable these bubbles are. So again, that is a part of our NCBC FLASH grant that we recently received.
Hello everyone, I'm Sinan Susand, I'm an assistant professor in the Department of Public Health at East Carolina University. I'm also a research faculty at North Carolina Agri-Medicine Institute. Welcome to my lab. This is the Aerosol Exposure Lab. And today I'm going to be talking about one topic, research topic that I'm working on, which is measuring the efficiency for respirators and fabrics that we wear nowadays during the pandemic to protect ourselves from capturing the virus or giving the virus to other people. So what type of respirators or fabrics should we use to protect us from the virus? Now, this is a surgical mask, and many studies have shown that surgical masks actually give a high level of protection compared to the N95 standard, which has a 95% efficiency. Now, people are also creating these masks using normal fabrics or material from clothes, for example, to create their mask and protect themselves. And the question is usually, what's the difference? If you want to have a high level of protection basically fabrics that are designed and created specifically for masks, they are not designed like this. They are designed in a mesh type of way. And this type of mesh basically provides extra protection and it prevents the particle from going through, especially the tiny ones, and it will end up landing on one of these areas and protects the person. Now, with these types of fabrics, you can see this mesh design, it's making it even more difficult, right, for the virus to go in, the small particles. At the same time, they're designed to have a low resistance. So they have a really nice breathing, and the healthcare worker, for example, or the occupational worker has no problem working 8 hours, for example, and wearing this mask, and it has low resistance and high breathing. So this is the main difference between creating a fabric by using material in the market versus fabrics that are specifically created to design a respirator.
I'm Charles Humphrey. I'm a professor of environmental health. I'm here today behind the athletics complex in a dry detention basin. This is a project where in the next year this dry detention basin will be converted into a wetland to help better treat stormwater. There's stormwater from about 30 acres from the surrounding neighborhood that feed into this basin.
My name is Melissa Nolan. I'm a master's student of environmental health here at East Carolina University. I'm working on my grad project, which is turning this, what was supposed to be a dry detention basin, into a wetland. And right now I'm collecting pre-retrofit data. So right now you kind of see there's like a dry detention area, but the latter part has turned into an unintentional wetland. It has invasive species, and it's not as efficient at filtering pollutants as it could be. So right now I've been recording about 7 storms so far since August on the input data from the water for all the pollutants and nutrients, and the output data as well for what leaves the system. So hopefully around March, we're gonna do the retrofit and turn this dry detention basin into a beautiful kind of meandering wetland. And that will be aesthetically pleasing for everyone here at ECU, especially those who watch the soccer games and tailgate for the football games. And it'll also serve as a great way to filter pollutants from our system. So awesome for the environment. My background, I'm actually a former science teacher, and I just wanted to get more into the field and be more of an active scientist. So I applied to ECU and got in and was super excited.
Usually what happens during a typical storm event is water in a natural environment will land on grasses or in forested area, and that water will infiltrate into the soil beneath. But when you build impervious surfaces like concretes, roads, buildings, rooftops, these surfaces impede that infiltration capacity, and pretty much in many cases you get no infiltration at all. So oftentimes you see practices like this that are designed to store water, stormwater runoff for a specific amount of time where it can slowly release into our natural waterways so we don't overload them with floodwaters.
Hi, I'm Melissa Nolan. I'm the director of the Nancy Darden Child Development Center, part of the College of Health and Human Performance. COVID has definitely hit us hard, like it has all of the other early education and early care centers. We've had to make significant changes to in order to continue to serve our families as they try to go back to work. In the beginning, we had to close for about 7 weeks until the state, the country, the university really understood what was going on and what needed to be done, and we definitely took a significant financial hit while we were closed, as did most businesses during that time. But we regrouped, we pivoted like everybody else is at this time, and we found a way to reopen and continue to serve our families. One of the best things about the center is we're able to serve the university students as well as the younger generation, the 3 months to 5-year-old age group. And once we pivoted in the spring, the students went home. We've had to implement mask wearing for all of our teachers while in the classroom, and when working with young children, them being able to see your facial expressions and your mouth when you're speaking, and those types of things is really important to their emotional development and their language development. So that's been something that we have all had to get used to, the teachers as well as the children. They've acclimated really well to that. We've had to take out dramatic play materials, so things like utensils that they would use to play in the kitchen, dress-up clothes, things that aren't easily cleaned to reduce the amount of exposure. Sensory materials like Play-Doh, the sensory table are items they just aren't able to use right now because we can't clean those things, and it's definitely something they've had to get used to. We are very thankful for donors, and the only way to continue to be able to serve the level of care and provide the level of care that we do is by donors. It provides a much needed financial support that was coming in from revenue. We are fortunate that we are almost all the way full, but as a center who has a significant waiting list in the past, we have seen a decrease in our waiting list, and we have seen a higher level of turnover in our children and families, something that we are not accustomed to. Thank you for all your support. It goes a long way with the university students as well as the young children we serve and their families.
These slides depict the Pirate Wellness Program, an adaptation that we did because of COVID-19 this summer. This was a program for rec therapy students to get their field experience and internship while being socially distant from their clients. You can see that it's comprehensive, adaptable for young adults, children, and older adults with disabilities or challenges with activity of daily living. There's our own Captain Quarantine, David Loy, the director of this program, who also worked with his students and whose program is getting national acclaim for telehealth in recreation therapy.
Hello, my name is Joe Homard, and I'm the director of the Human Performance Laboratory at East Carolina University. I'd like to talk just a little bit about an exercise grant that we have called the Motor Pack Study. It stands for the Molecular Transducers of Physical Activity in Humans. It's a very collaborative grant with multiple sites, and we've teamed up with Duke University to study humans and basically to find out why exercise is good. It's a great opportunity for ECU in terms of our students and faculty, as our students are able to get involved with other universities in carrying out the studies, as well as getting hands-on experience themselves in the extensive testing and exercise training that we're going to perform.
My name is Dr. Tiffy Blanchflower. I'm from the
Department of Interior Design and Fashion Merchandising, and I'm working with the student Amelia Pello Summer, and we're working on research to understand the impact of COVID-19 on small businesses within North Carolina. I know small businesses are really vital to the local community, and so that's why we wanted to focus on small businesses, as since COVID has hit since March, around 21% of all small businesses have closed and they've continued to close. The revenue has decreased about 30% also in this time frame, and this really matters because it is the backbone of small communities. As from 2010 to 2017, small businesses generated about 66% of all new job growth. This matters for a couple reasons. One, it creates local jobs. Two, when you spend your money at a small business, it goes further within the community. 58 cents actually goes back into the community compared to only 33 cents when you spend it at a large box store like a Target or Walmart. And also they foster diversity and also increase market competition. So they're really important. What we're focusing on is really how COVID-19 has impacted these small businesses. Understanding, how it's impacted day-to-day operations, long-term, short-term planning. Also what they've done to pivot with COVID-19 in terms of technology, so social media, online shopping, or any type of online merchandising systems that they've had to switch or transition to. And the whole goal is to really capture this moment in time and understand what's going on, but then also learn from that and kind of build tools and resources to help small businesses now and then also in the future. We will start interviewing small business owners in January. We had plans to start sooner, but like so many other people, COVID kind of threw a stick in our plans, and one of our team members was impacted by COVID-19. And so what we're going to do is resume in January, and we plan to look at businesses within small kind of like downtown areas like Wendell, Greenville, and even Wake Forest. For listening, and if you have any questions about our research and what we're doing, just email me below.
Welcome to the Rural Health Disparities Lab. My name is Alice Richmond, and I'm a professor in the Department of Health Education and Promotion within the College of Health and Human Performance. I co-direct the lab with Dr. Essie Torres, and the Rural Health Disparities Lab is an interdisciplinary lab that works to mentor students and community members in research. And overall, our mission is to reduce health disparities. So one research project in the lab is led by Dr. Abby Schwartz and myself, and Dr. Schwartz is going to tell us a little bit more about it.
Hi, my name is Abby Schwartz. I'm faculty in the School of Social Work in the College of Health and Human Performance. And as Dr. Richmond explained, we're working together on a research project called the Project TRIP Demonstration and Evaluation Project. The first important thing that you should know is that transportation is a major barrier to care for all vulnerable populations in Eastern North Carolina. That is what we are addressing in the Project TRIP Demonstration and Evaluation Project. So we are working in an academic community partnership with Roanoke Chowan Community Health Center that runs Project TRIP out of their center. We are also funded by the Duke Endowment. So in this project, we are going to be evaluating the successes and challenges that Project TRIP experiences, and then using that information to then implement Project TRIP in a neighboring county, Washington County, that has low resources and vulnerable residents in the county. So next, you're going to meet one of our team members, Miss Mallory Scott, who is a student as well as serves as our project coordinator.
Hi, I'm Mallory Scott. I'm a pre-med student majoring in public health within the College of Health and Human Performance at ECU. I'm really excited about working alongside with Dr. Schwartz and Dr. Richmond in this program about increasing transportation to low-income and vulnerable populations within Eastern North Carolina. I'm learning skills in research and about working collaboratively within the community.
I'm Nick Murray from the Department of Kinesiology, and we are currently running a study. We're looking at individuals who play sports and are in the military that have head injury. One of the things that we have seen in recent data is that those individuals with head injury tend to have a higher incidence of lower musculoskeletal injury. So post-head injury, we see a 1.2 to 2.9 increase in lower musculoskeletal injury, including knee injuries, ankle injuries, ACL tears, and the like. So what we're doing in this project is we're trying to examine some of the factors that may influence those lower musculoskeletal injuries by not only measuring their brain activity and then measuring also muscle activity as well. And we're trying to look at how the brain and the muscle coordinate while we have these individuals move through a virtual reality task. So we'll go ahead and start the simulation.
All right, please stare into the red dots until they disappear.
So at this point, we're calibrating the system, so her eyes are calibrating to those red dots that are appearing. And then she will do this virtual task.
Will you please look at the center target?
Okay, and this is what you're seeing here in the camera is she's moving down the virtual tunnel. And there are little dots that appear on the left and the right of the tunnel, and she has to react to those dots as they appear. So they're moving in one direction or the other, and she has to make a decision which direction that those little dots are appearing. What you can't see is that we're also measuring her eye movements in there, and so we can look at changes in eye velocity or their fixations as they do this task. And so we're doing this also in the VR environment where we will have them track a ball as the ball moves around, and they try to just stay on top of the ball the entire time. It seems like such a simple task, but what it really tells us is something about the communication within the brain. So someone with a head injury will have a harder time doing this task and have a more difficult time with the communication process within the brain. What you're seeing on the screen there, the red dot is her eye is her eye, what she's looking at the dot there. That's her eye following that dot. And you can see Callie has not had a recent head injury, so she's tracking it fairly smoothly with not too much variability.
The final portion of our program will recognize the 2021 Wall of Fame inductees. We thank Mr. Max Ray Joyner, who donated $40,000 to support the expansion of our Wall of Fame with a second board. Our two new inductees, Dr. Cheryl Johnson and Mr. Charles Chuck Baldwin, join the ranks of 44 outstanding men and women on the Wall of Fame. Their inductions have been sponsored by a minimum of $1,000. All donors are listed in the program, which will be displayed at the end of the program. The successes of the inductees are many, and the impact of their work is far-reaching. It is my honor to recognize the 2021 Max Ray Joyner Senior Wall of Fame class. Dr. Cheryl Johnson is the first inductee. Cheryl Johnson is known as a passionate and committed professional and servant leader who models exemplary teaching for the Family and Consumer Science Education program. She has empowered hundreds of students to improve the quality of life for individuals in their family, home, workplace, and community. With 28 years in higher education across 5 states, she has served as the FACS Program Coordinator in the Department of Human Development and Family Science since she became a pirate in 2010. Please give your attention to Drs. Bernice Dodor and Anu Hegde, Associate Professors in the Department of Human Development and Family Science, as they say a few words about Cheryl. Then Cheryl will provide a few remarks.
Hello everyone. It gives me a great pleasure to speak about my dear colleague, Dr. Cheryl Johnson, an inductee to the Wall of Fame this year. Dr. Johnson is an example of a servant leader. Every student knows that she is there for them. As the Family and Consumer Sciences Education Program Coordinator, she has keen interest in student success and motivates them to develop skills and expertise they need to grow in and out of the classroom. To me, Sherry is like family. We have developed a great relationship over time, working together on grants, research, and service projects, which resulted in scholarly publications, presentations, and effective teaching practice. With Dr. Johnson's love and dedication to the profession, she contributed significantly to building the online degree option of our program, the first in the state of North Carolina. Dr. George Johnson's commitment and years of service is much appreciated and well-deserving of this recognition. Congrats.
Good morning, all. It is my honor and privilege to talk for my dear friend, Dr. Cheryl Johnson. I have known Cheryl Johnson since the time she joined East Carolina University as an associate professor. Cheryl Johnson is no ordinary person. Cheryl is a gifted teacher. She is also a committed family and consumer science educator who has extensive experience in the field of education. She loves teaching her students and mentoring her students. She has served on several thesis and action research project committees with me. She has chaired some of these projects and theses, and many of these projects have gone on to earn honors at the national level. She also is very committed to student scholarship. She has helped family and consumer science students have the most number of scholarships. She works very closely with the donors and establishes a good rapport with them to develop these solid scholarships for the students. She is a talented, skilled teacher, amazing researcher, a great friend, and phenomenal mentor. I always look up to her and I always ask for her advice when I am lost within my own professional life. So Cheryl, today is your day and I'm so glad you are being bestowed with this honor.
Good afternoon. I want to say thank you for all those who participated in this award for me. I'm honored and I'm humbled. Thank you to Dr. Bernice Doder for nominating me, my program faculty compadre, and for Dr. Anu Hegde and both of you for speaking on my behalf. Thank you very much. I would like to thank Dr. Sharon Ballard and her continued support for family consumer science education and our programs here in the department. Your support is invaluable, Sharon. Thank you so much. I would like to say a special thank you to my parents, Joe and Joan Lango. I could not have started this education journey without you coming alongside me as a young widow with 2 babies and supporting me in getting my college degree to become a teacher. Thank you so much. Thank you for your support of this award. I'd like to thank my husband, Chief Master Sergeant, retired Air Force, James Brett Johnson, who came with me here to Greenville almost 12 years ago to begin our life here together. Thank you for your support. I would like to thank a couple other people that have been instrumental in my career, Dr. Chris Ward and Dr. Daisy Stewart. Chris Ward encouraged me to become a teacher educator when I was still in undergraduate school. And for Daisy, who was my mentor at Virginia Tech and who has been a mentor throughout my entire career, modeled for me what it is to be a family consumer science professional. Here at ECU, I have loved working with all of our faculty members in our department and in our college, and we have such a wonderful relationship. It's like being with family. I really appreciate all your support for this award and for my work here in family consumer science. I've prepared hundreds of family consumer science teachers across the years in my career, and here at ECU we've been very fortunate to build our program and stabilize it and establish it with online degree completion and also our graduate degree and our residency program. Thank you for our scholarship donors and those who contributed to this award. We really need your support for our students. I'd like to end by saying that the work that we do in family consumer science, really does strengthen and empower individuals and families to improve their quality of life. And I appreciate all that you've done in this work, in this department, and in our college. Thank you for your acknowledgement of this award.
Mr. Charles Chuck Nikos Baldwin is our next honoree, awarded posthumously. Chuck Baldwin served more than a decade as the College of Health and Human Performance only instructional technology consultant, prior to his work in the College of Nursing. Solving instructional technology challenges for faculty, providing leadership in developing exceptional quality technology integration into teaching and learning, designing web pages, staffing and equipping computer laboratories, and capturing the best angle for a faculty portrait are a few of the many ways that Chuck served HHP. Chuck willingly fulfilled other duties and gladly attended college events during and after business hours because he was designated as the photographer and archivist. Please give your attention to Dr. Sharon Knight, Professor Emerita and former Associate Dean, and Ms. Karen Vale Smith, faculty in the Department of Health Education and Promotion, who will be followed by Dr. Melanie Sartor Baldwin, Associate Professor in the Department of Kinesiology.
Hi, I'm Sharon Knight, and I wanted to speak about Chuck during his early days in the college. He and I worked together for years in the dean's office when it was located in Minges, and his office was just this little closet along the purple hallway, for those who remember us in Minges. Chuck had just come to us, but we discovered really quickly just how special he was. He was really quite brilliant, and he became such a key part of the growth and development of the college. Chuck could do anything. His role as our first IT expanded into special projects with faculty and with the college too. We no longer asked if Chuck could do something, we just assumed he could. And you know, every time he did, and it was always exceptional. Other people on campus heard us talk about our fantastic person that we had in that role, and sort of began to recruit him. So we had to quit talking about Chuck with other people outside the college. You know, no one better fits the designation Hall of Famer than my really dear friend and colleague, Chuck Baldwin.
Chuck Baldwin is most deserving of this prestigious honor. I have worked with Chuck on many projects since he first arrived at ECU. While most of us knew him as the fix-anything tech guy, he was so much more. His academic background, professional experience, and skills, as well as his keen intellect, enabled him to be an early innovator in distance education, pedagogy, and web-based instructional design. His early work on interactive educational interfaces and learning management platforms were the foundations of what is currently available from many of today's educational publishers across the United States. Chuck was also an accomplished and nationally recognized videographer and director. Together we co-wrote and directed and produced over 50 health education videos for McGraw-Hill. These were nationally distributed, and most are still being used in colleges and universities all across the U.S. today. Finally, and most importantly, I think, Chuck was a loving husband and father, an awesome colleague to all, and a good friend to many of us. Chuck, my dear friend, I love you, I miss you, and I wish you happy trails.
Thank you to everybody who supported and contributed to Chuck's inclusion on the HHP Wall of Fame. If you got to work with Chuck, you know that he was incredibly talented. He was always willing to help. He was enjoyable to be around, and while he was not a man of many words, he was one of the most kind and caring individuals you could ever meet. And if he was in your corner, he was going to do whatever he could for you. He enjoyed his colleagues while there. He thoroughly enjoyed the different personalities and skill sets of everybody he interacted with. And one of the most interesting things that I think a lot of people would like to hear is that he truly valued everything he learned along the way. Whether he was doing lectures or video or taking pictures, it was always an opportunity for him to learn something and to meet new people. And while he and I are both introverts, he did really enjoy the people that he met and worked with at HHP. We've long considered HHP to be family. That's primarily because he and I met at HHP, but it also has to do with his time there as a father. Those of you that worked with Chuck probably saw Charlie grow up along the way, and I know he truly valued the support of the college as he brought her up. And so I thank you for him, for Charlie, and for myself. And again, thank you for this honor.
Congratulations to the 2021 Max Ray Joyner Senior Wall of Fame class. We are grateful for your many contributions. Thank you for joining us for this special event, and thanks to our donors who made this honorary event possible.